Welcome back. Nicely done over there. You know, there's new evidence that suggests sleep apnea can lead to serious brain injury, disrupting memory and thinking. Dr. Craig Schwimmer, medical director at the Snoring Center, is here to talk about a new study from UCLA linking the two. Good morning to you.
Good morning, Brenda.
How'd you sleep last night?
I slept well, thank you. All things considered.
All things considered, that's right. Let's remind everyone what sleep apnea is.
You know, sleep apnea is a very common and very serious medical problem. It's a disease that's characterized by loud habitual snoring and repeated stop breathing spells. So people with sleep apnea snore really loudly, regularly, and they have these interruptions in their snoring and gasping episodes where they actually stop breathing. And those stop breathing spells can happen literally over 100 times per hour during the course of the night.
How common is this?
It's very common. It's estimated that up to 10% of adult males and up to 4% of adult females have sleep apnea.
So there's a new study right now from UCLA that says that there could be some serious brain damage associated with sleep apnea.
Absolutely, and this is a really interesting and worrisome, frankly, study because we've always known that people with sleep apnea have mental and other cognitive problems. They don't function as well as patients without sleep apnea. But we've always thought that that's because they're tired. When you're sleep deprived, your memory suffers, and when you're sleep deprived, your mental functioning isn't as good as it should be. And we've always said, well, you know, you're tired, and when you catch up on your rest, when we treat your sleep apnea, things will get better. What this study out of UCLA shows is that patients with sleep apnea actually undergo physical changes to an area of the brain that's associated with memory formation. And that's really worrisome because it suggests that these memory problems may indeed be permanent.
That's the mammillary tissue?
Exactly, the mammillary bodies, which are areas on the underside of the brain. And this study looked at about 100 patients, about 45 with sleep apnea and about 66 without sleep apnea. And they imaged the underside of these patients' brains and looked specifically at the mammillary bodies. And what they found was the patients with sleep apnea had about a 20% reduction in the size of the mammillary bodies compared to normal people. What's
the link here? Is there a link between Alzheimer's and this sleep apnea study?
Well, that's an interesting question. We do know that patients with Alzheimer's and alcoholics, two populations that also suffer from memory problems, also have these similar physical changes in the mammillary bodies. And so there's some thought that these memory issues may be related, and it may be due to the lack of oxygen that's seen in patients with sleep apnea and damage in the cells in the mammillary bodies.
Is the damage reversible?
We don't know. Early results indicate that it's not. And so that is really what drives us to tell people with renewed emphasis, if you suspect sleep apnea, early detection and early treatment is critical.
Because going years without treatment, you're not going to get that memory back.
Exactly.
It's gone.
It may lead to irreversible changes in the brain. And so we tell people with renewed emphasis, if you suspect sleep apnea, please get evaluated and ideally get treated early.
I'm sure that people are hearing their partners snore all the time, but then how do you know if it truly is a case of sleep apnea or not?
You can get a good idea clinically. Speaking with your doctor or speaking with a sleep medicine doctor who's expert at this can get a pretty good feel based upon a series of questions and a physical examination. But the only way to know definitively is with a sleep study. And one thing that's really encouraging is that with the advent of home-based sleep studies, patients can now get tested at home. It used to be that you had to go spend a night in a sleep lab, and that's still done quite often, but for many patients it's now possible to get a sleep study at home, which of course is much more convenient, less expensive, and just easier for patients to tolerate.
What does it involve? How do you do a sleep study at home?
Oh, there's a variety of technologies, but basically you pick up a device which is either worn on the wrist or underneath the nose, and there's a bunch of different technologies. You take the device home, you wear it to bed, you bring the machine back to the doctor in the morning, and they upload the information, and you get an answer right there.
Has the study shown yet how long you have to suffer from sleep apnea to have suffered some tissue loss?
We don't know that, but it's certainly reasonable to assume that the longer this goes on, the greater the likelihood that damage occurs and becomes irreversible. So again, early detection and early treatment are the key watchwords.
Okay, so again, going back to this home study and being checked out for this, if a spouse does suspect their partner is suffering with sleep apnea, what do they need to do?
They can call us, and we're happy to direct them to the appropriate place. We provide home-based sleep studies. They're relatively inexpensive. They're very convenient. But talk to your doctor, talk to us, talk to somebody, and get tested and get treated.
Yeah, that's right. So you can hold on to some of the stuff that we
Exactly.
that we learned when we were young, right? Thank you, Dr. Schwimmer. Always good to see you.
Thanks, Brenda.
The Snoring Center has 2 locations, one in Dallas, the other in Fort Worth. Log on to snoringcenter.com for more information.